Hi, it's the nursing professor here to wrap up our discussion on pharmacology. So today we're going to talk about meds that affect the reproductive tract, those that affect bone disorders, pain management, and some of the diabetic medications. So let's get into it. All right, so reproductive tract. So typically we think of things like contraceptives because, of course, we know that women take contraceptives, and those are hormones that we take for that. And so men also take hormone therapy, which is testosterone. So sometimes with males, they are determined to have a low level and they take supplements. And so there are some things they need to be aware of. So with androgens, which is testosterone, they should be aware that they can gain weight. They could get facial hair on their bodies. Just swelling, and so they need to be aware that those possibilities can happen. They can also be aware that sometimes it does not really improve their testosterone level, and so they need to have that conversation with their physician. With women, they can also take testosterone, estrogen, and progesterone, and so we want to make sure, especially with women, that they understand of the possibilities of thromboembolic events with taking contraceptives. In particular, younger women who may not be aware that they will be at a higher risk for blood clots. And so that would be a nursing consideration, and of course taking the medicines as prescribed. Moving on to joints and bones, we want to think of treating diseases like fibromyalgia, rheumatoid arthritis, gout, lupus, those types of autoimmune diseases. And so with fibromyalgia, then not enough is known about it. And so many times the provider is really trying to determine what is the best course of treatment. And so one of those treatments include norepinephrine reuptake inhibitors. And so with that, with some people, they feel better, sometimes they don't. And so if they don't, then of course we don't want them to be in pain. And so frequently they're prescribed pain medications, like your non-steroidal anti-inflammatory medications. I had a brain fart just now. Another disease is rheumatoid arthritis, can be very painful, also deforming to a person, and so treatment typically are glucocorticoid steroids, NSAIDs as well. Gout, person gets inflammation of their joints. Sometimes gout results from taking too much antidiuretic, and so it can be very painful and swelling, usually at a joint, like the elbows or ankle or something like that, and a person just can't really calm that down with taking over-the-counter medications. And so one of the medications that are frequently used is colchicine. Colchicine works very well. However, sometimes the side effect can be diarrhea. Anytime we hear of diarrhea being a possible side effect, we want to make sure that our patient understands about possibility of dehydration, because a lot of fluid can be lost if a person suffers from diarrhea for a long time. Lupus is the other joint and bone disease that we are going to talk about. And so with lupus, anti-inflammatory meds are prescribed, NSAIDs, corticosteroids, monoclonal antibodies. And we heard about monoclonal antibodies when we learned about a treatment for COVID. All right, and so methotrexate can also be used with these diseases as well, especially rheumatoid arthritis and lupus. One thing with methotrexate is a category X, should never be used with a pregnant woman, and you want to make sure that the person understands that they should monitor themselves for infections, because it can suppress the immune system, monitor liver function and bone marrow suppression, and so we want to make sure that they are aware of that. Hydrochloroquine is also an anti-malarial agent, which sometimes is used to treat lupus, and some people have success with that. Nursing consideration, we need to be concerned if there's any change in vision, because retinal damage has been associated with it, blood dyscrasias, and severe skin reactions, even so much as Stevens-Johnson syndrome. And we know that that is can be a very critical side effect from the medications. Moving to bone disorders, most of these are associated with some sort of calcium deficit. And so many times people take calcium supplements, and those can be something as simple as Tums, okay? But many of the bone problems are a little more serious, like Paget's disease or postmenopausal osteoporosis, where these bones are just really deteriorating on themselves. The person's at a greater risk for falls and fractures. And so some of the drugs that can be used, the first one we'll talk about is raloxifene. It is category X. Remember, category X means never give it to a pregnant woman. And we want to monitor the person's liver functions with that. But how it works is it does slow the progression and preserve some bone density so that it's not as rapidly happening, especially to the postmenopausal woman. One of the most common drugs that we have to be aware of, and there are lots of nursing considerations with this, so listen up, it is your biphosphonates. And with that, an example of the drug is alendronate. And with that, we want to monitor the kidney function. It works to decrease the actions of the osteoclast as they work to form bone and inhibit bone reabsorption. And so with that, then hopefully the bones won't degenerate as quickly as possible. Is used in both males and females, and again, especially with someone who has Paget's disease, where they have a deformity in the bone and their structural changes in the bones that actually results in pain, fractures, and arthritis. The main nursing consideration is esophagitis, and that is where there's a tear in the lining as you're swallowing this. So nursing considerations would mean that this person either needs to be sitting all the way upright or standing. You can't give this to a person who is bedridden because there's such an increase of esophagitis. And so when they take it, they need to be upright for at least 30 minutes, and they should not take it with any other meds or medications, food for an hour. They should also make sure they're getting adequate water, like 8 ounces, with ingestion of the medication, okay? They should discontinue it if they note any type of swallowing problem, okay? So make sure that you're teaching them that. Calcitonin can be taken intranasally, so whenever we do that, then there's a little less complications with that. But it also works to decrease reabsorption by inhibiting the activity of the osteoclast, which is very similar to the bisphosphonates. Used primarily to treat postmenopausal women and also Paget's disease. Now, one of the signs, or two of the signs of hypocalcemia you should be aware of is Schross-Stex and Trousseau's. Schross-Stex indicates a low calcium level when a person actually has abnormal twitching as their facial nerve is touched. Whereas Trousseau's happens when a person has a manual blood pressure cuff placed on them. You inflate it for 20 to 30 millimeters of mercury and above where their systolic is, and then you will see an abnormal spasm of their hand and their wrist. And those are cautionary signs that we should be aware of. Pain management is often used with these medications. You have your non-opioids and your opioids. With non-opioids, you're going to have things like your NSAIDs, which include your ibuprofen, naproxen, aspirin even, and of course acetaminophen. So with your NSAIDs, you want to, nursing considerations include teaching your patient about GI discomfort. If a person already has a history of GI bleed, then you want to caution them about taking the medications, making sure they take it with food. It has been associated with an increased risk of heart attack and strokes, and so if a person has a history of that, then you want to be cautious of it as well. With aspirin, you need to be concerned with tenuitis, which is ringing in the ears, and Ray's syndrome, especially with children. It can also interact with heparin and warfarin, so you need to be aware of that if a person's already on a blood thinner, to use that cautiously. Acetaminophen is thought to be a little more benign. However, if a person has liver disease, you want to use it very cautiously. It can be used for either an analgesic or antipyretic. Toxicity can happen if a person has liver damage. So 4,000 grams per day is the maximum amount allowed. 3,000 grams if a person has liver disease. Caution them not to take it with alcohol. Opioids are your narcotics. We've already talked about narcotics are those things that a person has a higher propensity to addiction. And so those are going to be your morphine drugs, your fentanyl, meperidine, those types of things. And so nursing considerations include monitoring for respiratory depression, constipation, orthostatic hypotension, teach your patient to change positions slowly, urinary retention, sedation, and nausea and vomiting. They can also interact with antidepressants, so you want to be cautious of that. And then we have your agonist, antagonist opioids like butorphanol, which can be used with anesthesia, also to treat or relief of moderate to severe pain, and frequently used with people who have an opioid addiction. All right, so same nursing considerations about respiratory depression, sedation, dizziness, headache. You always want to hold these medications if the respirations are 12 or less. You should always have on hand, anytime you're given a narcotic, naloxone, which is an opioid antagonist. And so you want to be cautious to make sure that you're not administering the medication too fast. Last but not least are your anti-diabetic drugs, or your diabetic management drugs, I should say. And so with that, you have insulin and non-insulin. And so with insulin, you want to look at basically 4 different types. You're going to have Lispro, which is rapid acting, acts within 15 to 30 minutes of administration. Regular short acting, acts within 30 minutes to an hour of administration. Intermediate acting would be NPH, the onset is 1 to 2 hours, and long acting would be your Glargine or Lantus, which onset is 1 to 4 hours. Nursing considerations including making sure that your patient is aware of signs of hypoglycemia, because sometimes the blood sugar will drop. Okay, you want to monitor closely for that. Teach them to wear a medical alert bracelet, teach them to rotate sites, because insulin is administered subcutaneously. There are multiple oral diabetic medications on the market now. Just going to touch on a few. You'll have your sulfonylureas like your glipizide, glyburide, and they work to release insulin from the pancreas, so your pancreas is still working. Those are frequently used early on when a person is diagnosed with non-insulin dependent diabetes. The other most common medication you'll hear would be your metformin, which reduces the production of glucose within the liver. It can cause GI upset and anorexia, and so some people do report some weight loss with metformin. And then, of course, you have all of these non-insulin injectable medications, which are these medicines that every commercial talks about, and these work to decrease gastric emptying time. They also have been associated with weight loss, and they can be used with insulin in type 1 diabetes. And so that discussion is still out there, but probably not on NCLEX at this time because it's still too new. So that is it for now. That wraps up our discussion on pharmacology. Bye for now.